My name is Candace McClory. I'm the opioid program specialist for the Public Health Division in City of Lynn. We just wanted to bring out these trainings during Public Health Week so everybody is aware that there is an opioid crisis and people are overdosing. We just want to make sure you guys have the tools to be aware of what an overdose looks like and how to respond. Okay. So a couple things we're going to cover. We're going to cover what are opioids, how to identify what an overdose looks like, what naloxone is and how does it work, naloxone also known as NARCAN, how to respond to an overdose, and then I'm going to give you NARCAN if you want it. Okay, so first thing is, what are opioids? Do you guys know what opioids are? Are you familiar?
Yes.
What's an example of an opioid?
Oh, I'm nearsighted, so isn't it just like any drug you could get addicted to, right?
I mean, yes and no. Opioids are mostly like pain relief kind of meds, but they are very addictive, yes. There are three types of opioids. We have natural opioids, which are chemical compounds that are extracted from the plant, the poppy plant. And those include opium, morphine, and codeine. And then we have semi-synthetic opioids, which are from the plant but then chemically synthesized. Those include hydrocodone, oxycodone, heroin, and oxymorphone. And then we have synthetic opioids, which are completely chemically made. And those include fentanyl, methadone, and tramadol. They're synthesized to have opioid-like effects. They have no natural occurring substances in them. Okay. So everybody, you guys have heard of fentanyl, right?
Mm-hmm.
What can you tell me about fentanyl? What have you heard about it?
They just mix it with something.
It's addictive.
Right.
Very addictive, and it is being put in a lot of things.
Yeah.
So a couple of things that are really important to know about fentanyl is 50 times stronger than heroin and 100 times more powerful than morphine. It also binds faster than any opioid, which is dangerous because it makes people, it doesn't have what's called legs, so it makes people want to use it more frequently, which puts you at higher risk for an overdose and also infections. But it is also frequently used in medical settings. They have fentanyl patches. A lot of people who are in end-of-life care are given fentanyl. Some things that aren't true. Simply touching fentanyl will not cause you to overdose. You have to actively ingest fentanyl. So that means you have to sniff it, swallow it, through your, eat it somehow, or inject it into your veins. Just being in the vicinity of it will not cause you to overdose, so it's not going to get picked up by the wind and go into your nose and overdose. And it also cannot be absorbed through your palms. Your hands don't have the appropriate mucous membranes to attract to the opioids that cause it to get into your system. Yes, so if you get any near you, just stay away from it and wash your hands. So what is naloxone? Are you guys familiar with what NARCAN is?
Yeah, it's like when you overdose, you put it in your nose.
So NARCAN is what we call an opioid antagonist. So its only job is to remove the opioid receptors from the brain temporarily and reverse the effects of an overdose. Now, a couple important things to know about it. Like I said, it only works for opioid overdoses. This is a good thing because if you're walking down the street and you just so happen to see somebody that's unconscious, but you don't know them, you don't know what's going on with them, you can use your NARCAN, and if it's not an overdose, it's not going to hurt them. It won't help them, but it also won't hurt them. It won't cause them any additional issues. It takes about 3 to 5 minutes to work, so in the 3 to 5 minutes that you're waiting for the NARCAN to work, it's really important that you're giving rescue breaths to people. What an overdose is respiratory failure. So anytime that the brain does not have oxygen to it can cause damage. So the longer the person is without breaths, the more damage that can be caused. There's no potential for abuse for NARCAN. You cannot get high off of it. Its only job is to reverse the effects of an opioid overdose. It is recommended that you store it at room temperature. If you have it in your car, you can still use it, but the effectiveness may not be 100%. So just make sure that you try your best to keep it room temperature. Have some in your purse if you want. If you don't have a purse, in your jacket or something. And then they do expire. These boxes here expire in 2026, so the expiration dates are usually about 2 years long. Do you guys have any questions? Okay, so responding to an overdose. So a couple of signs of an overdose is low or shallow breathing. So the person may be completely unconscious at this point, and you may hear what we call agonal breathing. It kind of sounds like they're snoring. This is really important if you have a loved one that is staying with you or something and they actively use. If they happen to be sleeping at an awkward hour of the day and it sounds like they're snoring, just check on them, make sure that they're okay, because it may actually not be them sleeping. Another way to identify an overdose is the skin tone. So oh my God, I can't talk today. The skin tone may change. And the fair skinned people appear a bluish color, and darker skin tone people maybe like a purplish grayish color. Those are signs of an overdose as well. The first thing you want to do if you see someone with an overdose is give them a sternum rub. This causes the most amount of pain with the least amount of damage. So if they're not overdosing, this should get them to respond. So once you've determined that this is in fact an overdose by giving them the sternum rub and they don't respond, you want to get them in a position where you can administer the NARCAN. This is what the NARCAN looks like. Oh my goodness. Sorry. This is what the NARCAN looks like. These ones are 4 milligrams. And once you press this red button right here, it disperses the entire medication. So make sure that you don't press this button until it is inserted in the nostril. So first thing you want to do is you want to get them in a position where you can administer the NARCAN. If they're sitting down, lean them back and tilt their head back. If you're in a way that you can get them on the ground, that's ideal. So you want to get them on the ground, open your NARCAN. Red button, careful, don't touch it. Tilt the head back, block one side of the nostril, insert it, and press the button. Like I said, once you press that button, it disperses the entire medication, and it takes about 3 to 5 minutes to work. So in that meantime, you want to give rescue breaths. So that's 1 breath every 3 seconds. So block the nostril, tilt the head back. 1, 2, 3. 1, 2, 3. 1, 2, 3. And you want to continue that process for about 3 to 5 minutes. If they do not respond within that 3 to 5 minutes, you can give the other NARCAN. Each kit comes with 2 NARCAN. At that point, you want to switch nostrils. There may be a reason why it didn't work on the first side, so you want to switch it. Same process, grab the NARCAN, block the nostril, put it in, press the button, and then rescue breaths for 3 to 5 seconds. 1, 2, 3. 1, 2, 3. And you can continue this process until either they respond or until 911 arrives. You can give them as many NARCAN as you have, but it's really important that you try to wait the 3 to 5 minutes, because the more NARCAN you give somebody is going to determine how they respond. The more NARCAN you give, the sicker they're going to be. So it could be a difference from them just waking up really gradually to being a very dramatic wake up where they're throwing up and they're very, very sick. Now, is everybody familiar with the Good Samaritan law? You guys are? So what this is, what it specifically states is it protects people when calling 911 or intervening during a medical emergency. Specifically, they grant immunity from arrest, charge, or prosecution for controlled substance possession and paraphernalia offenses when a person overdoses. So a lot of people think that the Good Samaritan law covers you for everything. It does not. If you have a significant amount of drugs on you, if you have a warrant or any weapons on you, they will, you are at risk for being arrested. But if you have personal use drugs and you are just responding to an overdose, you will be okay. Please call 911. Like I said, those are the limitations. If you have warrants, weapon, or what we like to say weight, so the 3 W's. Those are exemptions for the Good Samaritan law. You guys have any questions about that?
No.
Okay, good. So, best practice versus minimum. So, bare minimum, administer the NARCAN and call 911. That's the best thing that you can do for someone if you have the NARCAN on you. Best practices, we would call 911. We would have our NARCAN, our PPE. We would administer rescue breaths, and we would call 911. We understand that situations don't always call for ideal best practices, but we do provide face masks with each kit. This is what our kits look like. Each kit comes with a resource guide, which provides quick refresher on what an overdose looks like, and then how to respond to an overdose very quickly in the instructions here. And then on the inside it offers resources. So detox information, outpatient information, harm reduction information, family support services are also in here. And then we also have fentanyl test strips, how to use fentanyl test strips, the helpline information, and another pamphlet on how to use an overdose, because we understand it's an anxious situation, and you kind of forget sometimes. So pictures and illustrations, English and Spanish. And we have these kits in 5 naloxone box locations throughout the city that you can grab at any time for free, no questions asked. Like I said, they come with resources as well. Those locations are Western Ave, the Lynn Commons, Broad Street and Cherry Street, Liberty Street and Central Ave, and Mount Vernon. We have boxes there, so you can grab NARCAN anytime. No questions asked, for free. If you use it, lose it, you can come back and get more from us. You guys have any questions? No? Okay. Oh, and one more thing I wanted to mention, because we do understand that people are hesitant, especially when it comes to rescue breaths. But it's really important because drug trends have changed. In the early 2000s, heroin was the big deal. You guys remember hearing about heroin, and then it slowly started to shift to fentanyl. So when it started to shift to fentanyl, that's when we started to see a big increase in overdose. That's when NARCAN started to come out and started to be easily accessible to people that are using. And now we're seeing a shift again. We're seeing a shift from fentanyl over to xylazine. Xylazine is starting to be put in a lot of the drugs, the opioids specifically. And the issue with it is it's not an opioid. It's actually an animal tranquilizer. And it causes severe wounds and infections. And then it gives extreme sedation time, so that can affect with opioid overdoses. So even if you respond to an overdose, that's okay. Sorry, I'll let that pass. So when you respond to an overdose, you don't know what the person's drugs have been tainted with. It could have been xylazine, so it's really important that we focus on the rescue breaths, because xylazine, one of the causes, one of the things that happen during xylazine use is extreme sedation for several hours at a time. Like I said, and this is what exacerbates overdoses. It makes them even more dangerous. So that's why we really want to stress rescue breaths' importance. That's why we put our face shields on here to make sure that you guys are safe while you're giving rescue breaths. We just want to give people any chance they can with the information that we have. Thank you.